name is Kelly Helm. I'm the Executive Director of Patient Engagement for NephCure. And we are thrilled to have you here today to talk about mental health. Not only is it Mental Health Awareness Month this May, which I can't believe that we're almost done with May, which is crazy, but we also had a really impactful session at our patient summit in April around mental health. In fact, when we surveyed participants, it was one of our top 2 most favorite and impactful sessions. And so we really kind of wanted to piggyback off of that and continue the discussion with some of our patients in our community and just talk about how mental health, how rare kidney disease patients are impacted by mental health. And I think we can probably all relate and understand that it's not brought up enough within the medical community. But we just wanted to, Kristen and I, my colleague Kristen Hood and I just wanted to sit down with some of our patients and really hear from them about how rare kidney disease has impacted their mental health, how they have learned to cope with that, and what we can do moving forward to help other patients not have the same struggles or at least be able to have tools to cope with them. So with that, I'd like to introduce my colleague, Kristen Hood, who's our Executive Director of Research Engagement. She'll be my co-moderator today. And then I'm going to give our panelists an opportunity to introduce themselves. So I'm going to start with you, Kayla, if you'd like to introduce yourself.
Hi, everyone. My name is Kayla. I was diagnosed in 2007 with FSGS and recently found out that it's genetic. Both of my daughters have the mutation. My mother had the mutation. She passed in 2014. So my girls are in remission. I am relapsing currently, trying to figure out that treatment, but we're doing okay.
Thank you, Kayla. Sorry to hear that you're relapsing. Angelica, I'll go to you next.
Hey everyone, I am from New Jersey. My name is Angelica. I am the patient parent of a 6-year-old with minimal change disease. His cause is genetic as well.
Brad.
Yeah.
Oh, I think we just lost Brad. Okay, we'll come back to Brad. Safariana.
Hi, thanks so much for having me today. I'm Safariana Day. I live in Seattle, Washington, and I was diagnosed with membranous nephropathy in 2016. Have never been in remission, but have somewhat of a controlled, at least on the outside, feeling good, but knowing that stuff is still going on and still losing protein. So that's where I'm at. Thanks.
Hey, I'm sorry about that. I just had a call exactly when you said that and it dropped the line there. So
that's okay. You can go ahead and introduce yourself now, Brad.
Okay, my apologies to everybody. My name is Brad Price. I'm in California, and I was diagnosed 22 years ago, initially with minimal change. I've had 3 biopsies, 2 that indicated minimal change, and the last was FSGS. And fortunately, 4 years ago, I did 2 infusions of rituximab, and I've had no symptoms of my kidney disease in 4 years through flus, colds, various things. So, but was a steroid dependent frequent relapser for 20 years, basically.
Great, thank you. Rosie.
Hi, I'm Rosie. I was diagnosed with IgA nephropathy in 2014 officially. I started the workup in 2013. But I had signs, really not symptoms, but signs for quite a few years before then, as far back as probably 2005, 2004, with blood in my urine and insanely high cholesterol, total cholesterol almost 500. And so it was actually a lipid specialist that finally caught the kidney disease by referring me to have proteinuria tested in my urine because of a lack of response to high dose statins. So anyway, I'm from Virginia. not originally, but that's where I currently live. I'm originally from Michigan. So I have a lot of experience with the healthcare industry, both for my profession and treatments. And so I'm happy to be here today to talk about this topic.
Thank you, Rosie. And last but not least, Tiffany.
Hello, my name is Tiffany. I live in Maryland. I'm originally from New York, even though at this point it's been half and half, but I'm still gonna claim that New York. Yes, I'm from New York. I was diagnosed with FSGS in August of 2020. August of 2020. I'm currently in remission. Fingers crossed. I got another lab that I need to do. But yes, currently in remission. And prior to being diagnosed with FSGS, I was diagnosed years before that with major depressive disorder. So I do have experience with rare disease and mental coping with mental illness.
Wonderful. Thank you so much. We're just really grateful for all of you. I know that sometimes it's not the easiest to talk about our mental health and feelings and things like that, but Krista and I are going to kind of ask questions popcorn style here and get to know you all a little bit better. So we know that patients and family members coping with chronic illness are at a higher risk of developing depression and anxiety. Tell us a little bit about how your kidney disease has impacted your mental health. And I'll just open it up to the group.
This is Brad. I can start. That's okay. I had the day-to-day living with kidney disease. I was in chronic pain for probably 10 of the last 20 years with some associated sort of some side effects of the drugs and the treatment. I caught colon cancer from the immune suppression. I had to have a complete colectomy, and I started having heart issues. I had a couple of major heart attacks that were linked to the high cholesterol, probably chronic high dose prednisone. I was on probably an average of about 20 milligrams a day for 20 years. So that alone, just the side effect of the prednisone was crazy. And then you link all the uncertainty of not knowing when you're going to relapse. I'm sure everybody who's got this disease can just, the frustration of, if I catch a cold, I might relapse. I might relapse even if I don't catch a cold. It's just such a very erratic disease, and just that lack of control. And they've done a lot of mental studies on this. When you have no control over your destiny, that tends to traumatize more deeply. So I like I said earlier, I've been in a complete remission. Physically, I cycled 5,000 in the last 2 years. So I just did a 100-mile ride on my 60th birthday. So physically, I've actually recovered dramatically with all my physical issues, but now I'm just dealing with kind of PTSD-like symptoms. I have kind of a chronic anxiety disorder that I never had. I was very social. I traveled around the world, still software, and I find it difficult sometimes just to even be in very simple social settings. So it's pretty profound how it's affected me mentally. And I've really been focusing the last 4 years on just trying to kind of pick up the pieces mentally. So to answer your question, pretty profoundly in my case.
Yeah, thanks for sharing, Brad. It's really great to see you doing better physically, but I can relate. I think once the physical, the 24-hour triage life goes away, then we're left to deal with what we've been just trudging through. And so thanks for sharing. Tiffany, were you going to say something?
Yes. So just, like you said, the physical parts, right, are the parts that like our medication deals with, or that, when you go to the doctor, they're like, oh, if you're having, this symptom, they're more apt to like treat those things. But the mental pieces of it is like the things that you either like can't do anymore. Maybe it could be things that you're worrying, like, if it progresses, am I going to be able to do these things? So for me, like starting out, I got diagnosed right in the middle of, COVID lockdown. And so it was like in some cases, it was that was a benefit because I was able to like be home and not have to be super active. But then it's sort of like, I feel like it made the depression a little bit worse, in the sense that now I'm like, every time I have to leave the house, it's a thing. Like, it's a whole big thing that I have to like mentally prepare for and all that. And then just the weight gain from it, and the weight gain and the joint pain, like not being able to work out, that used to be the biggest thing that I did for my mental health. And so not being able to do that is something that is really, that's been really, really, really hard for me. That's probably been the hardest part of all of this, is not being able to work out the way that I would want to.
Rosie?
Yeah, I think I definitely echo everything that's being said, but I can definitely share specifically back to the beginning of my diagnosis, where I, one of the first things I did was go to counseling and go to a therapist. And it was because I knew I was diagnosed with this life-changing illness, and I knew I needed to do something, and I needed to, try to get ahead of it, is what I thought I could do. It was like, I'm sort of a control freak, and I'm like, if I get ahead of this, like I'll win, or something. And it was just absolutely obviously impossible. It was like I had no idea what was coming. I had no idea, how to manage this. And I think one of the most frustrating things was that my nephrologist, when I would go see my nephrologist and I would tell him, everything that's happening with prednisone. I mean, I did the high dose prednisone for, I ended up being on prednisone for 7 months total, but it was high dose for 4 months, and I was just absolutely miserable. And I would tell him all the side effects, all the things that are happening to me, both mentally, physically, everything. And it was sort of like, it's not my problem. It's like, go to your primary care provider. And I go to my primary care provider, and my primary care provider is like, there's nothing I can do for you. And it was like the cycle of like, what do I do? Who's going to help me? And nobody would. And I just felt like I was, just nobody gave a shit. Like, everybody was just like, it's literally not my problem. You're fine. You're not going to die. And I actually recently read in some health notes from my primary care provider that were like, the patient has talked a lot about like, all of these things that impact her, and all of these worries and concerns that she has about this illness that she has, but she's like, it's not terminal. It's sort of like, it's not like she's not going to die. So like, we're going to try to, help her understand that, this isn't very serious, and like she can function and live and, go on with life. And, I've since started doing acceptance and commitment therapy, over my journey to mental health and like health and wellness in my life. But it's sort of like, if you read that note, with open notes, thank goodness we have that. But I'm reading that note from my healthcare provider. It's like, they're still not getting it. They're still not getting the aspect or the role that they need to help play as your clinical provider in that engagement, in that, in that way that they can help you. It's like, you literally feel like they just don't care in that role, in that visit, in that place. And that's been my experience from day one. And yes, I'm in remission, but I have scares all the time. Everybody's talking about being scared. I recently was threatened, like quite literally, with a biopsy again, which was the worst thing in my life because of some blip on some numbers. And thankfully we retested and did 24-hour urine collection, and I went through that, and I didn't have to go through a biopsy again. But these are things that we're all terrified of. But we just have providers that just sit there and look at us, and they're like, it's not my it's not my problem. Like,
Yeah.
you deal with it. So
Almost like it could be worse is not a helpful attitude. Kayla, did you have something to share?
So another thing that I want to touch on is the fact that a lot of these rare kidney diseases are silent. They're not outwardly shown. So a lot of my frustration comes from when I am relapsing and I'm exhausted and I can't move and I don't want to get up because my legs are so swollen. You can see the swelling in the legs, but until you actually feel fluid-filled legs, and it's awful. And it's like I try to explain I'm so exhausted because my body is going through something right now, but they don't understand. And then, like Rosie was saying, my doctor is like, oh, go to your PCP, get some medication. My PCP's petrified to prescribe me anything because of the kidney disease. He's so scared to help me with anything. And it's almost like, where do I go? And then you add on top of that the lack of mental health care providers just in general throughout the nation, and it's almost impossible to get help. Like it's so challenging because it's like, I know I need supportive care via therapy and via medication. I'm fully aware of that. I just can't get anybody else to be fully aware of that to help me. So
Yeah. And Kayla, I'm going to shift gears here, and you're in a unique position because not only are you an adult patient, you were a caregiver to your mother, but now you are a caregiver to 2 children who also have the same disease. So I'm curious if you could talk a little bit about how some of these challenges with mental health, have they affected your children? And then I want to ask Angelica to talk after you, as a perspective of a mom, of a caregiver. And so if you wouldn't mind starting, Kayla.
yeah, so with my mom, her treatment was quite different than mine because it wasn't, when she was diagnosed in her childhood years, FSGS wasn't a thing back then in the late 70s, early 80s. And if it was, she didn't have access to those providers that could help her with that. So when I was younger, she got transplanted when I was 10. And I remember thinking, yes, this is, perfect. And then the transplanted kidney failed, and I had to go through all of that. And then I get diagnosed. And I'm sure for her, the guilt that I feel for passing it on to my children is overwhelming. Like, and it's nothing I did intentional, and I know that I didn't do it on purpose, but the guilt is just unimaginable. So now my kids, they do have anxiety. We are dealing with a little bit, my youngest especially, she was officially diagnosed with hypoplastic kidneys, and she has a lot of questions about that. Like, what does that mean? What's going to happen? And then her doctor, I love him to death, but he treats me as a patient as well, like non-specific information. We can just go ahead and wait until 6 months and then we'll check up again. And I'm just like, I understand that I'm a patient as well, but I would like some more supportive care as a parent. I would love to have a social worker for the kids to be able to work with them, I think it's a child health specialist that can work with play through, explaining that situation to them, because my youngest is constantly questioning, why do I have to take medicine every night, Mom? Why do I have to go to the doctor? Why do we always have to go? We have to drive to Nashville, Tennessee. It's about an hour away for their specialty appointments. Why are we always in the car? Why do we always have to go to Nashville? It's like, no, I don't know if Angelica, you feel this way, but it's like there's no supportive care for the kids. They try to treat them, but mentally they're not connecting, at least for our situation. It's like they're not connecting with the children mentally. Like, how do you feel about this? Or what can we do to help you understand better? It's just like, take this medicine, your kidneys are sick. That's not good for a kid. They want to know why. They want to know specifics, and there's no support for them either. So it's kind of rough.
Kayla, are they on prednisone as well? Are they having any?
Due to the genetics, we actually don't do steroids at all. So we're on ACE inhibitors to kind of delay the proteinuria, but luckily they're in remission with just ACE inhibitors for now.
Fantastic. So, relatively fantastic.
Yeah. Angelica?
I feel you on everything you just said. One thing I did want to say, that not knowing who to call when they get sick is like the biggest problem, because I have the same problem with the pediatrician. She's like, well, what did the nephrologist say? And the nephrologist is like, what did the pediatrician say? And I'm like, can one of you guys like make a decision? Like, okay, if it's a cold, it's a cold, but can we just figure it out instead of everybody just like, what did that person say? What did this person say? Like, one of you guys just make a decision. In terms of the question, the mental toll, I feel like I'm in a state of like silently worrying constantly while smiling on the outside. Like, we went to a party yesterday and I'm like looking around and I can still tell you how many times anybody who sneezed. And like, I'm
Yeah.
right away looking around like, all right, you can play on this side of the pool, not over there by that person, because I don't know if it's allergies or if it's COVID or if it's the flu or if it's something else that's weird that's going to pop up on the news tomorrow. So I'm like constantly just like in a state of worry, but I try to like, you know, smile and like stay positive for him. As for support, I can agree with you on that. In our end, we've been very fortunate. NephCure teamed us up with Team Impact. And I feel like Marcus now has kind of like a team. He's got his own village. So like, he doesn't feel like left out anymore because he's kind of got like a thing. Like he knows he has kidney disease and we're very specific with our kids. We've always been very open. Like, of course, we explain things. Like I have a 9-year-old, she's healthy, thank God. And I have Marcus, who's the 6-year-old. But we've always been very open. We've explained everything, like science-wise, as to what's happening, how it's happening. So he kind of gets it. He's been through different stages. I would say he's currently going through the annoyed stage of his disease, where it's just like, oh, yes, I know I gotta drink water. I know. So he like rolls his eyes, but then like Team Impact has helped a lot because now that he's really into baseball and he's hanging out with the college guys and he's kind of like understanding the importance of nutrition. So now he's like, doesn't fight me as much. He's like, okay, yeah, I want to be big and strong like those guys. So, okay, I'm going to listen to you. So we've been fortunate on that side of things that I don't feel like he needs therapy just yet. Like I feel like his sibling does, because sometimes she does feel left out. But as for Marcus, I feel like having Team Impact and having that community, that little village of his, that's his thing, that's for him. And I feel like he's been a lot better ever since.
Angelica, do you want to explain a little bit about what Team Impact is, just for our listeners?
So Team Impact is an organization that partners up kids with chronic illnesses with college teams. So Marcus was partnered up with Montclair State University's baseball team, and he basically becomes part of the team. They have a signing day. They have like an official like letter welcome him into the program, just like if he was recruited into a college team. It's the whole experience. He goes to practices, he goes to games, they send him videos, they send him text messages, we exchange emails. Marcus, he's in T-ball right now. So the team came out the other day to his T-ball game. So it was pretty awesome.
Wow, that's cool. Very cool.
I want to switch gears and come over to Safariana. You had mentioned that you've never been in remission, and that's, you know, brings a little bit different path than those who are constantly going into remission and out of remission. I'm curious, how does the fear of the unknown and not having a treatment or not having answers around your membranous nephropathy impact your mental health?
I would say, gosh, I feel like Angelica's kid, where I'm like, what's the point? I don't want to take the medicine. It's not working. It doesn't matter. I think that's where I get to my lowest, is when I start to feel like a little bit of hopelessness, just around, because I've been on, you know, I started out on cyclosporin and prednisone and experienced all the side effects. In the first 6 months, had a lot of weight gain and like couldn't run. I was running before like half marathons and I had to stop, and like that was really disruptive. And you know, eventually the swelling went down. I've really got not much now. Like every once in a while it kind of flares up, but it's for the most part kind of invisible now. But when I go to the doctor, my nephrologist is like, your levels are still really high. You still need to be taking the ACE inhibitors, which also have their own side effects. And so I think it's just kind of this roller coaster of like, is this even working? I had a biopsy last year where they said, you know, there's some scarring, but you still have to kind of keep going with what you're doing. And so I think, to me, just back to that feeling of hopelessness, is like, is there ever going to be anything that works? And it can start to feel just that sense of dread, and that I'm just kind of doing the same thing over and over again. And that can be really hard to kind of, like, I have a therapist that I talk to, and I didn't start talking to her really about this disease until the last year or so. And she was like, "You've never really talked to me about this." And I'm like, well, it's starting to really affect me now that I would like to get pregnant soon. I would like to have a baby. And that is a thing that no one really talks to you about when you're a woman in your 30s and you want, and the clock's ticking, and but oh, your pregnancy could be, at high risk. And so you have to start seeing those doctors. And so there's just all these sort of things you don't really know about, I think, that I didn't really know about when I first got diagnosed, that are kind of adding to that sort of feeling of hopelessness, and just sort of questions around, how do I move forward? Even though I'm not having these really wild, effects of the disease right now, there are these underlying things that are just kind of constantly under the surface. And it can be hard to deal with them when they feel really subtle, if that makes sense.
Yeah,
Yeah,
absolutely.
I'd like to follow up on something that Safariana just said about fertility and specifically with our kidney disease. And this might be a little bit of a fairly unique perspective as well, because I was a volunteer birth doula and had a midwife for a mentor, and really learned a lot about the entire spectrum of childbirth, and just always had a personal ambition of trying for a natural childbirth, and really having a midwife and being at a freestanding birth center, and always having that approach. And honestly, when I was diagnosed with this disease, I just knew that was just never going to be an option. And now I don't even know that my own natural children are an option. And so I keep having these conversations with my nephrologist where it's sort of like, oh, you can just stop taking your medications, and it completely invalidates the work that I've put in to keep this condition in remission. And it's sort of like, you can just sacrifice your own body and your own health to have a child. And it completely belittles sort of the idea that I'm still a person and I still exist and I still live. And while that is still something that I want in my life, it doesn't mean that I have to give up my own health and my own life to have a child. This is a very serious thing that we're facing, and a very serious loss and a lot of grief. And I don't think that we've gotten enough attention around this. And so thank you, Safariana, for bringing that up, because it's just sort of looked at as it's not a big deal.
Yeah, I agree. And just so you know, Chris and I are actually working on some resources for rare kidney disease and pregnancy, because there is a large group out there. Some of us have teenage girls who are going to start asking questions. And as you said, Rosie, there just aren't answers. Or some nephrologists say, oh no, you can't, just let go of those dreams. You can't have your own children. And I don't know that that's really the answer either. So we agree, and we're working on it.
Yeah, and I think you both have brought up, we've been talking about how we've heard from several of you how your mental health or how your disease has impacted your physical health. And so, but when we talk about mental health, this is also affecting your physical health, and the ability of just a natural way of thinking if family planning or pregnancy, or is that, if that is a goal of yours, then obviously this is impacting your mental health as well. It's a different aspect, right? And so thank you for sharing, Rosie and Safariana. I think it is really important information, and we need to do more work around this area because you're not alone. And we are working on some resources. So thanks for sharing those unique perspectives. What other ways, I'm curious, what other ways has your mental health affected your physical health? So outside of, Kayla said, the swelling of her legs, and, it's hard to get up, or just the physical nature of the disease impacts your physical health. But what about your mental health, and how has that affected your physical health?
This is Brad again. I mean, this is really impossible to prove, but I absolutely believe being on steroids and just the way I responded to every single event for 18 years, that, of course, high cholesterol and some of the other incumbent treatments, but that led to heart disease. I think, I had a heart attack. I was a vegetarian, and I was 2 weeks away from climbing Mount Rainier when I got diagnosed. So I've always been an athlete. And, I just think that they're so interrelated. I don't know that we tend to draw this firewall down the line between physical and mental health. I just think they're one and the same almost. I truly believe, a lot of my chronic pain, I lost my sense of smell and taste. And I just don't know that the mental component, I don't know how to decouple the two together. I just think they're so interlinked. But for me, I could just name cardiovascular disease as one example that I think was, I'm certain the prednisone and then the attendant depression and chronic anxiety caused from the prednisone was a major contributor to that.
Yeah. Thanks for sharing that. Tiffany, I'm curious, you were open in your intro about your history with, a depressive disorder, and then obviously being diagnosed with FSGS. I'm curious, how has your mental health affected your physical health through this disease process since you were diagnosed? If you could expand on that a little bit.
So I would say, basically one of the ways is that, like, of course, if you are, having a depression episode, and you're just kind of like not wanting to do anything, or just feeling like, what's the point of going to the doctor or taking, like, it can get to the point where you're like, you have all these meds literally every single day that you have to take, right? And sometimes you just get to this place where you're just like, why am I taking all of these meds? Like, is it going to help? Like, if mentally you can't push through to take your meds. I missed my last doctor's appointment because I woke up that morning and was just like, yeah, I'm not leaving the house. Don't feel like getting dressed. Do I know that it takes like 5 months to book an appointment? Yes, I know that. Right now, if the appointment was today, I would absolutely go, because I know how hard it is to make an appointment. But in that moment, I don't care. I was just like, whatever, I'm not going. When she calls, like, hey, are you coming? Didn't answer. Like, it's just, so I think that it can affect it, because it affects your ability to do the things that you know to do when you're not in that state. But when you are in that state, it just makes it harder. And then it's so much stuff that needs to be done, that you need to pay attention to, that you need to avoid, that, if you're in that space, it's hard to take care of yourself and then do all the extra stuff that also needs to be done. So that's how I would say, like, it would affect, physical health, because it affects your ability to do what you're supposed to do to maintain good physical health.
Absolutely. And Rosie, did you have a comment about your history with running? And
yeah, so I mean, before I was a very physically active person, I think my life, it's a very distinct change, basically, like, it was like my life before prednisone and my life after prednisone are very different. Prednisone marked a cascade of physical injuries, just all kinds of things that just went downhill. And with those physical injuries, I had 2 torn ACLs. In between, I had a hemangioma, an intramuscular hemangioma taken out of my leg, which is completely random, but I wouldn't have ever found it if I didn't have to rehab an ACL tear. And I ended up finding out I have a, hypermobile Ehlers-Danlos, which is completely random, but taking prednisone is not good for somebody with hypermobile Ehlers-Danlos. I can tell you that. And I've since led to now I have, all these other conditions, hyperadrenergic POTS, like I have now dystonia and just all kinds of issues. Like, so it's so much pain in my body, and yet like I have to be careful with medications I take for all this stuff because I have a kidney disease. But I think the frustrating thing for me is that like I know that prednisone was like the start in the cascade of all of this to like sort of save my life, right? Like to save myself from something like end stage renal disease, which was something I knew very much about, or save myself from a transplant, and from a poor quality of life. And yet here I am living what I would define as a poor quality of life. So it's a catch-22 for me. But I think the part that was so hard is that I got to a place of very poor mental health. I was self-loathing. I didn't love myself anymore. I gained 70 pounds. I was in pain. I couldn't run. I couldn't even walk my dog. There was, because I had these surgeries and like I couldn't rehab myself all the way, and then I just kept putting on weight, and it took so much to pull me out of that. It took it took going to therapy, it took doing all this stuff, and I had to drive that. I had to identify that, and I had to drive that. And then now I'm sitting here, having these conversations, and all of these things are coming to light where I'm like, wow, like this is actually a lot harder than I realized it was. And there was not help, there were not resources, and it's sad. I'm sitting here and I'm looking at these faces and I'm seeing these posts in the chat, and my heart just hurts right now.
Yeah, we hear you, and we appreciate you being here and sharing some vulnerability, obviously, with us.
Kayla, did you have something to say?
Yeah.
Sorry, I thought I saw Kayla.
Oh, no, yeah. So kind of to piggyback off what Rosie was saying, I think that so it's sort of your question in a little bit of in addition to Rosie. So once you get diagnosed with something like this, I think the mental break, and then I think it's, for me personally, it was getting diagnosed with FSGS and then 7 other diagnoses that I didn't even know I had. And then you get that on top of that, on top of that, on top of that, and on top of that. And it's like one treatment contradicts the other. And then this treatment doesn't even have a treatment, but they suggest physical therapy, or they suggest, because I'm also hypermobile. So I have bone pain, joint pain just from hypermobility. And so when she said that, that's like, you can go out on a walk one day and dislocate, like your shoulder from walking. And it feels like nothing, like she said it before and after. It's like I didn't experience any of this until my diagnosis of FSGS, and then like everything came crashing down. So I don't know if that's attributed to mental health, because a lot of inflammatory conditions are linked to mental health, are linked to disturbances with various hormones and all of that. So it's almost like you can't catch a break. And I'm just really thankful that like I am hearing these stories, because like it does put it in perspective that I'm not just the only one out there dealing with this every day. So
Absolutely. I know that we've mentioned prednisone and high dose steroids quite a bit. I'm curious if there has been any other medication that you all have been on or are on, and you feel like that also impacts your mental health or anxiety.
I can. Well, so
Yeah.
it impacts mental health because of what it does, like
Yep.
to you, right? So because of being on the steroids, my doctor makes me take an antibiotic because, when your, of course, immune system is suppressed, she's like, one of the things is that people catch, she was like, I can't even like fill in the blank because it could be anything, like things that like have been dormant since dinosaurs, like you can catch because your immune system is suppressed. So then you're taking antibiotics. If you've ever taken antibiotics for a month, you know the havoc that it wreaks on your digestive system, on your gut, right? And I've been taking them for 2 years straight. So it's just like that, like this weekend, for example, like I just been drinking smoothies because everything I ate either made me feel nauseous or it just created, like I just couldn't eat anything. But we had a cookout, and like so we had people over at the house, and I just can't eat. Like it got to the point where literally I got nauseous, went upstairs and laid on the floor in my bedroom, fell asleep. My husband walks in and I'm like sprawled out on the floor, and he's like, what is wrong? I'm like, I was nauseous. Everybody's in the house, and I just disappeared for like an hour. And it just happens. Like you don't know when it's going to happen. You don't know when stuff is going to hit. And that's hard because it makes it hard for you to plan things. Like even when you plan something, you already know all right, I got to mentally push through this. Who knows what I'm going to fit that day? Because if I'm retaining water, I may not fit my regular clothes. So it's like, I got to have this outfit and then this outfit that I feel okay in. Then you have to deal with all right, am I going to be able to eat that day? Or like just all those other things. It just compounds it. And of course, with the medication, like everybody else said, like you take one that creates this thing. So like something with the prednisone made my heart beat really fast. So then I had to take this other thing that created high blood pressure because most people who take that, I don't know, it was just weird. So then I had to take that. Then the prednisone makes your sugar go up. And so then I had to take like so
cascade. A cascade.
So many, right. So you walk, and then that's the other thing. Everywhere you go, you got these, you either got a bag full of pills because you didn't feel like putting them into the stupid pill containers, or you're walking around with the stupid pill containers, right? Like it's one or the other. So that's also just, it adds to all those little things, add to it.
Yeah.
Can I just add to what Tiffany said?
Yeah.
Yes, please.
We went on vacation to Dominican Republic in April, and I had a whole carry-on. I called it my urgent care bag. And I had everything on there. Like I told all his doctors, we're going on vacation. It's international, but like, you know, something that's supposed to be relaxing, it turned into like a little bit of stress because I'm like, okay, I need to find out where the closest, best hospitals are to where we are going to be. Like I need to have every medication that he ever takes, like, because a lot of flights are getting canceled. And I'm like, no, I need to be prepared. I need to, in case there's a cancellation and we stay there an extra week, I need to have extra of everything. I need to make sure that the phones have an international plan in case I need to call a nephrologist, a pulmonologist, a neurologist, the pediatrician, or any other ologist that he has. Like it's a lot, like just to go away to where you're supposed to be relaxed. It's like, there's so much planning behind the scenes that people don't even realize.
Yeah, that's a really good point. I just, the word cascade just keeps coming to mind because it's just one cascade after another. I'm curious, Seferiana, you talked a little bit about seeing a therapist, as did a couple of other folks. Have you found a specific type of therapy or mental health resource that's helped you cope? And can you explain and talk to us a little bit about that?
I mean, I can speak a little bit to I've been seeing my therapist for many, many years before I was even diagnosed. And I think, I don't know that I can speak to a specific type. I mean, it's generally talk therapy, but something that she's really talked to me about is like, kind of, and what's kind of been alluded to a little bit is just the interplay between like our emotional health or like traumatic experiences that have happened in our past and how they relate to our physical health. That's been something that she'll kind of talk to me about, like abandonment issues or just like different things that have happened in the past. And she'll kind of say like, how do you think that impacts your kidney? And I know that sounds kind of woo-woo, but it's also like thinking about how the things that have happened to us impact our physical health. And then it's holistic and it's all related. And I think that's a thing that's kind of popped up today, is just thinking through like the physical relates to our emotional health. And I know that when I'm like, a very practical thing that she has me do is like, if I'm feeling anxious around the disease, if I'm feeling depressed or that hopelessness, or if I'm feeling overwhelmed, she's like, take a break. You know, what are the very practical things you can do to kind of catch your breath, feel calm, you know, take a walk. She's really instilled in me that I need physical activity, even if it's a walk every day. And so that's one thing. And I mean, one of the things that she's done with me is called EMDR, which is like emotional, gosh, I can't even think of the, the exact acronym, sorry, but that's a really, sorry, I'm coming off COVID, my voice. That's a really like very physical, just you're like holding a bar and it's very energetic and you're kind of reprogramming yourself to like deal with some of those very past traumas that maybe aren't happening today, but how are you healing things in the past just to kind of have that holistic impact. But that's one modality that she's used for me.
I've actually done that as well and found it very helpful. It was exhausting, but very helpful. If anybody wants information, feel free to reach out and we can get you information on that. Kayla, did you have something to add?
So for me, I think I have a lot of PTSD. CPTSD is what they call it because it's recurrent. I have what killed my mom and I gave it to my kids. So it's like a constant reminder, like she died, you could die, the kids could die. And it's like, everybody's like, oh, don't blame yourself. Because I didn't know I had the mutation until 2020. My girls were born in 2012 and 2014. I had no idea. And for years, nephrologists said that they were different. So it's like, you can't blame yourself. However, how do you not blame yourself for giving your children something that could, I mean, that's going to change their lives forever. And I think a big thing that she had me do was I always had to be the strong one when I was little, not kind of, because, you know, mom had her kidney disease, dad was the one that transplanted. I've always had to kind of put myself to the side and take care of everybody else. And she said the biggest thing that I could do is to acknowledge what I'm going through. Because a lot of the times we're like, oh, nope, we don't need to acknowledge this at all. We don't need to think about what's happening now. We just need to focus on, you know, the future or figuring out what I can do to control everything. I learned to, if I'm sad about, you know, what we're going through, I'm going to sit and be sad. I'm going to acknowledge it, but I'm not going to let it stay. And then I'm just going to let it go away. And if it comes back, that's fine. We can acknowledge that too. And then another thing is, what can I control right now? Because if I can't control something right now, it doesn't need to stay in my head for very long because there's nothing that I can do 10 days from now, 20 days from now. So really focus on being present has helped a lot. Just today's a good day. Kids are having a good day. I'm having a good day. We're going to go to the park after we're done here and we're going to have a great day because I'm not going to sit and worry about what could happen to them in the future because I don't know anything, you know? So I think it's really important just to stay present in the moment and allow yourself to be sad, grieve for yourself, grieve for your family that has to watch you struggle, grieve for your child that's sick, grieve for, just feel it, because if you don't, it's going to eat you alive and it's going to, like Tiffany and like Brad said that, and Safariana, it's going to affect you physically if you don't acknowledge it mentally first. So
that's really great advice. Acknowledge and give yourself a chance to feel those emotions, but then also almost set a timer on that and pick up and focus on what you can control and what's happening in the here and now. Rosie.
I mentioned this before that the preferred method of therapy that, you know, I've really gravitated towards is acceptance and commitment-based therapy. And that's really because with ACT, it's really, you develop a relationship with things that you struggle with, and, you know, rather than fighting with them. So for example, you know, I have the ability to take a lot of these challenges with health-related trauma, or just the fact that, you know, what I was sharing earlier with fears and concerns about fertility, or, you know, health fears and concerns about, you know, more injury, or, you know, whatever. or recurrence of disease activity. All of those things are obviously always here and in the back of my head, but I don't sit and worry about them all the time. They're just there and they're just thoughts. It's just like, these are thoughts that I have. I acknowledge them, I validate them, but thoughts are just thoughts. And so I have a relationship with them, but I've really developed sort of this idea where, that it's not going to control me. I'm going to make active and, meaningful changes in my life to live my life and, in sort of a positive way. And I think with the thing that really turned me away with CBT, which is, just another sort of type of therapy, was just that I really felt like it didn't acknowledge all of the stuff that I go through every day or have been through. And it didn't validate it and allow me to just sort of be real about it. And I think ACT does. And so I think that that's just why I have a better relationship with this type of therapy. And with IgA nephropathy, you go through a lot. There is a lot of junk you go through, and it's a lot of trauma, a lot of pain, a lot of fear. And so it just works better for me. So if there's any other people that relate to that with this condition, maybe that's something that would be.
Yeah, thanks for that, Rosie. Brad, did you want to comment?
Yeah, I just ordered all my medical records for this sort of self-flagellation exercise. I just wanted to go and really try to process this. And so far I've gotten 4,500 pages from 4 healthcare providers, 70 trips to the ER. I've had my heart restarted with paddles a dozen times, too hard, all the stuff I talked about earlier. And listen to Kayla talk, it's complex trauma. I mean, we've all of us have undergone so many micro and macro traumas that there's just this collective, I think almost anybody with a chronic illness is going to have some element of PTSD that will present in various ways. I have been a big meditator. I took the John Kabat-Zinn meditation course before I got sick, just kind of on a lark, and I've used that. And the comment about just being mindful that I think was it Tiffany or Kayla said, they're just trying to be present. That's a real, it's a big component of the meditation. Just try to not think about tomorrow, not regret the decisions I didn't make correctly, medically or otherwise in the past. I've tried CBT, cognitive behavioral therapy. I've done dialectic behavioral therapy. EMDR didn't work for me. I have found EFT, which is a very simple. If you just Google EFT, it's a real simple kind of variation of EMDR. It's something that they've used a lot on Iraqi war veterans and found it to be very effective. Yoga and exercise, and I think it was Rosie who was talking about exercise and what a big component of, and I know I'm in a remission, so I'm able to go out and do exercise I wasn't able to do. But for 18 years, I would lay in bed and just try to do a yoga, lift my leg up, just try to feel like you're fighting back with exercise. I've also done some things like ketamine therapy, and I'm looking into doing MDMA, which is not, it's not legal. You have to kind of do it under the radar, but I've read white papers out of some major universities, and I think it's very, very effective for complex trauma and for PTSD. And also things with like psilocybin, which just got legalized in Oregon. So I kind of look at this as maybe there's not one silver bullet. It might be, 5 things that work, but I have a checklist of things I do every day. Some type of exercise, meditate, yoga, statements of gratitude, all these different things. Collectively, they make life bearable, but I'm still not really feeling like I've kind of licked the mental part of it. I just feel struggle. I struggle with the chronic anxiety disorder now, which I never had. And then chronic, depression, it kind of piggybacks that anxiety. So, but I would just encourage people to just keep trying, just keep looking for those things that will help you. And it's different with everybody. Some people get immense value out of CBT, cognitive behavioral therapy. I didn't really find it to be that effective for the reasons that I think Kayla just stated, that it just didn't feel like it really mapped to what my situation was. but I think it could be very effective for, other people. So.
Thank you. Thanks for that,
Mhm.
Brad. You've tried a lot of things. And, and maybe that's part of the journey as well, right? To try to find the right coping mechanism or right type of therapy that fits best for you and that you see results with. Just to wrap things up. Yeah.
I was just going to add one real quick. I'm sorry but Sefriana was mentioning about just the loss of hope. And you feel that way. I mean, that's what depression, and then you had depression on these things. And I felt that way physically. I tried every drug under the sun. I finally found rituximab, which so far has been it's been a godsend. It's put me in remission for 4 years. I never, ever thought I would have a sustained remission without massive doses of prednisone. So I think, it sounds like a platitude, but I really do try to tell myself that every day, to just keep, keep putting one foot in front of the other. There will be, some relief in the future, that, some new medications, some new therapy, something. I found that on the physical side. I still think that's possible on the mental side. So anyway, sorry.
Yeah. No need to apologize. I appreciate that. I think, one of the things that I have heard throughout this hour, because we're at the top of the hour, I do have one last question, and I would love for each of you just to provide, an answer. But one thing that I've heard from you is the importance of validation, and I want you to know that we have heard you today, and our audience has heard you, and you can probably have read the comments in the chat. But I want you to know that you are important and your journey is valuable, and we do want to help and support you in the best way that we can here at NephCure. And so please feel free to reach out to us. If you are an audience member or if you're on this panel, you can email Kelly or I, and we can always try to get you a referral out if there's needed, or give you some resources. We do have some available. So, but next steps. This is the final question for each of you. I'm wondering if you could just briefly, what is one thing that those who want to support you, those who do support you, what is one thing you would like to tell them how to help you cope better? How can they support you in this journey? If there's one of the most important things you'd like to share, what would that be? And Tiffany, do you mind if I start with you?
Sure. All right. So one thing I would say is, I don't know, pay attention to patterns, because sometimes, especially depending on where you are mentally, you may not be able to verbalize exactly what you need or what is going on, but patterns can maybe just help somebody to be able to not have to ask, but just to be able to just kind of like proactively, do something. Maybe just say, like, let's go for a walk, so that you get outside and get fresh air. That might just help your mood, versus saying, well, are you going to stay in the house all day? Like, just being a little bit more proactive, I would say, would be the biggest help.
That's a great advice. I appreciate that. Brad?
Yeah, I mean, my wife had to live with a guy on high dose steroids for 18, 20 years, and it's if a person gets sick, the whole family gets sick in a sense, right? So I would try to just tell her, please just read about prednisone and understand. I mean, it's very difficult. I'm over 40, 50 milligrams. I'm almost psychotic on this stuff. So it's of course impossible for her not to take me being this crazy man personally. And I just, that one component of this whole, and some of you folks, my good chunk of you guys, I know I have a lot of experience with prednisone. I just think that's one thing right out of the gate that the family, everybody should sort of be prepared for, that this is going to change who this person is. And I mean, I became a person at times I just didn't even know. I would just say things and do things that were just, crazy now. But I literally couldn't control it. I mean, I was under the influence of a very, very powerful drug. So just I'm not really giving an answer directly to your question. That was one of my huge frustrations, is I just never felt like, I mean, they're treating me like, okay, Brad's Brad, but Brad's really not Brad. This really is not who I am. Please understand when I'm at this level of prednisone, I'm going to do the very best I can, but I would just try to get away from, my family, try to go, distance myself in one of those really bad periods. But that was just one of the really, really tough parts on specifically on my wife. And God, she's been phenomenal to stick through it. But,
I think that's really important. And I think that we know that medications, steroids, and others can affect our mental health and how we communicate and interact with each other. And so that's a really great point. And thank you for sharing that, Brad. Angelica, do you want to go next?
I would just say be patient and listen. Sometimes very hard for others because sometimes they feel like when you're venting to them, they need to fix it. And sometimes I don't need you to fix it. I just need you to listen, give me a hug, and let me continue on.
Yeah, great points. Great points. Safariana?
I would say to encourage some balance. I've been told by my partner that I work too much, and I do think that's true. So I think like having someone around you just encourage you to get outside, go on that walk, not work so hard, to really take care of yourself is really important.
It's really great. Balance. It's a great word. Thank you. Rosie?
I will echo Angelica actually, because I think I say that often. I personally don't need to be fixed. I find partners or family or just people that are well-meaning, where they're really trying to help, but I don't need to be changed or fixed. I just need to be. And I honestly am trying to get through this and try to figure it out, and it's different every day. And even though I've been living with this condition since 2014, I've developed all these new conditions, and really what I need is just for you to be there, and be there in a capacity when I need you, and just be patient and be understanding rather than try to make it better, because I don't know what the solution is to make it better. I don't have the answers. But I'll tell you when I need you. So that's really just what it is.
Yeah, absolutely. Thank you for that. And Kayla?
So I also, what Angelica and Rosie said, but I also would love for my care partners and loved ones to not hide what they feel. I don't want them to suffer in silence for how they feel with what I'm going through, because I totally understand that it's not a walk in the park to love somebody that's sick. So I would really appreciate them just being open and honest when they're struggling too. And if they want more information, please ask, because that helps a lot. And I know it's hard for some people though. They don't want to bring it up, or they don't want to, trigger you with what they say. And no, just if you're struggling, please let me know. You don't have to do it alone, and neither do I. I know that. So that's super important for me.
Kayla, that's a phenomenal point, because I find myself almost that you ought to know you should do this. And I learned through years of that. No, you just got to go out and ask. I think I'm taking notes on your comment. I think that's a beautiful observation. So thanks for sharing that.
Yeah. I just want to take this opportunity. I know we went over a little bit, but this has been so informative and such a great panel. We just are so grateful for you all being open and vulnerable with us and sharing your journeys. And I hope that mental health loses its stigma really soon. And maybe more conversations like this need to happen in order for that to happen as well. But thank you so much for sharing your journeys and your feelings and what you've been through. And I, based on all the comments in the chat, take a second to read those as panelists. Everyone is saying thank you for being so open and sharing your stories. And we're just really grateful for you all. And as Kristen mentioned, we won't stop here. We're continuing the conversation. Again, those of you who have further questions or comments, feel free to reach out to us at NephCure. And I hope you have a really good rest of your week. And we'll hopefully talk to you all soon. Thanks so much.
Take some time for yourself too. Thanks so much, everyone.
Yeah. Thanks for putting this on.
All right.
NephCure
Bye.
folks, appreciate it.
Sure thing.
All right, be well, everybody.